that day that we were there was 1 million wildebeest that went from the Serengeti to the Masai Mara. And when we went up, it literally looked like ants. We saw, would you rather do like a veneer case, or would you rather do like a big surgery implant case? If you could pick between the two.
Implants.
We're kind of getting best case scenario with our case tomorrow. We're doing
A little bit of both.
a little bit of veneer, a little bit of implant, but a full smile makeover is just 100% the best.
I think the outcome of the patient and watching the patient transform is the best part.
But you would never, like, you would not try shrimp,
No,
salmon.
no seafood.
Okay.
I'm paranoid
Why?
because shrimp are see-through.
Welcome to our podcast, Riding Shotgun with Dr. Lon McRae. We have with us today two of the most important people at the office, and they are my surgical assistants that I literally can't do anything without them. And I am so grateful that you're here. Thank you. We've got Kenzie Verba and we've got Sarah McRae, and they are fabulous at what they do. And we're going to learn a little bit about them. So first of all, Kenzie, how long have you been with McRae Dental?
Since summer of 2019.
We were just talking about that earlier today.
Mm-hmm.
When you came and you interviewed at the office. I was mad at you because you wanted to go to another interview. And I was like, I like you. Why are you going somewhere else? But I didn't say that. So
Just trying to be nice.
But you came into the office, and how many interviews did you have?
So many. I had reached out on Facebook because I was living in Eastern Idaho at the time. And I said, I'm going to be moving to Meridian, Idaho. I'm looking for a job. And you had 2 or 3 hygienists reach out to me, including Katie. And
I didn't even know that.
mm-hmm,
Oh, wow.
yep, they said, we're losing an assistant and we're wanting to hear from you. And so I got a call from Deborah. She interviewed me over the phone, as well as your current assistant at the time, Dakota.
Who's Dakota? I'm just kidding. I'm kidding. We love Dakota.
We can't forget Dakota.
No.
She was great. She was my mentor for a very long time.
So she reached out to you too.
Mm-hmm.
Oh, wow. I didn't even know all of this.
Mm-hmm.
Okay. And so you came and you interviewed. Did you even have a working interview?
Mm-hmm.
Oh, you did. Oh, apparently we liked you.
Yep.
Yeah. And then immediately after you were hired, what happened? You went on some trip with the rest of the team.
I knew about this trip before the team.
Oh, you did? Oh, that's right.
Uh-huh. You told me in your interview.
Oh, yeah. I told you before I told anybody else that we were going on a cruise.
Yep.
And where did we go on the cruise?
It was a Caribbean cruise. Yeah. The prettiest cruise I've ever been on.
Western Caribbean. And you were new to the team. And
brand new.
Yeah.
I had only been there for like maybe 4 months.
Yeah. And then you ended up, I'll never forget, you were famously known for something that you did on the cruise every night. What was it?
I found the crepe station.
And you ended up telling the whole team, and none of us else knew about this crepe station, and we ended up all eating crepes and because of you. Mm-hmm. And now you're known as the crepe lady at the office. No, I'm just kidding. But so how many offices had you worked with before you came to our office?
I did a externship with a pediatric dentist. That was for a month. And then I worked in Eastern Idaho at a general dentist office.
For how long?
1.5 years.
So what makes our office a little different?
100%, it is the respect that your team has for you.
Oh, well.
Mm-hmm.
Thank you.
Mm-hmm. I've never seen a staff love their boss more than I have seen that here.
I think it goes both ways. I absolutely love the people I work with. You wouldn't be there. I mean, it kind of works both ways, right?
Mm-hmm.
We have a great team right now, but I mean, you guys, man, you rock. In fact, I often call you guys doctor. Dr. Kenzie, Dr. Sarah, because you constantly are telling me you forgot this step in some surgical procedure.
Yeah.
And it's like, okay, yeah, I get it. Sarah, okay, tell me about you.
Oh, geez.
So How long have you been working with us?
Just over a year in February. So a year and a half almost. It's been a year and a half.
You, so how many offices had you worked at before?
I think I worked at 2 offices before. The first office, I was there for 2 years, and the second office was about 2.5 years.
Yeah, but okay. So my understanding was that the last office you were at, you thought, oh, you know what? I'm here. I like it. I'm comfortable. So what made you
Yeah.
decide to even apply?
I wasn't even looking, and I didn't apply. It was crazy. So kind of the same situation as Kenzie. Um, I wasn't even looking, and one of the hygienists, Jordan, reached out to me on Facebook and
How did she know you?
through Sam,
Oh,
our other hygienist, because she had came from that same office. And then Deborah did a phone interview, and then I came in for a working interview, and you offered me the job on the spot.
yeah. And you were like, okay, he's crazy, but maybe I'll give this a
I
try.
might give it a try. Yeah. So it was, I could tell in the interview, the working interview, the culture and the difference, because I came from not so good cultures. So I could immediately tell that that was going to be my dental home.
Yeah. You guys have really, I mean, I look at where you have started and what you're doing now. So one of the things that you both decided to do, did you guys decide together to ask me if you could go and learn how to do phlebotomy?
I think
I think,
so.
yeah.
Yeah.
Mhm.
Yeah.
Yeah. So it, so I'm wondering, um, is that one of the most, I mean, isn't that one of the funnest things that you do is something that has pushed you beyond what you thought you would ever do? Did you, when you got into assisting, one, did you ever think that you would see so much surgery?
I was terrified of surgery. When I was in dental assisting school,
Mm-hmm.
I never thought I would work for a surgeon because it was so foreign to me. Now drawing blood, like that's the coolest thing ever.
You're drawing blood, you're doing PRF. I mean,
Mhm.
you're seeing huge surgeries.
Mhm.
We're taking and completely opening up people's entire jaws and working on that. Um, it kind of makes going back to just doing fillings kind of boring, doesn't
Oh,
So boring. So boring.
What did I say yesterday? I was like, we were working on a patient and I was doing all these fillings and I looked at you and I didn't even say the words, but you knew what I was feeling.
Mhm.
I was like, okay, never. And then you go, okay, I got it. And
Yep.
yep. And you tell the rest of the team, okay, he's done doing fillings.
Yep.
But then they were like, okay, you can't stop doing them right now. We got too many on the books, is what they ended up saying. Right.
Yeah.
So, but you decided that you wanted to go to phlebotomy school and you guys did it together. How was that? Tell me about that experience.
That was scary. It was,
Why?
I've got a phobia of needles.
Mm.
So my mom actually was a phlebotomist, and I would look at her and tell her, "You are crazy for doing that. I'm never going
I
to
didn't
poke
know that your
someone."
mom was a phlebotomist. Oh,
Mhm.
wow.
Yeah.
Okay.
So I remember her coming home with a tourniquet, and I was like, "You're not even touching me with a tourniquet." And here I am starting IVs every day. So it's kind of weird, but it was fun. It was good. Good educational.
Mhm.
What did
You
you think?
have to walk around like this, hiding the veins, because I would only let Sarah touch my veins, and vice versa.
Yeah.
Yeah, because how many was
Mhm.
in your class that you did your phlebotomy
Probably
school?
like
We had a
15.
pretty big class.
Yeah, we had a big class.
Yeah, and so you had a test, and who was your test subject?
You.
Oh yeah, I went and was your test subject.
Your biggest fear.
Unbelievable with
I-
your fear of needles.
I hate it.
Mhm.
But so yeah, I'll never forget. You guys were so nervous, and so they have to. How many veins did you have to hit?
I think we had to do 2 hands and 2 arms.
Mhm.
And you poked me 5 times, if I remember right.
Yeah,
Yeah,
I do think I missed.
you missed.
I
yours.
think I did too.
Good job.
Sorry.
Excellent.
You're a good sport.
But now, I have seen. I mean, I honestly would say you guys are right there, as good of a phlebotomist as I've ever seen. I mean that. You guys really are
Thank
good.
you.
Thanks.
And is that one of the things that you look forward to doing with patients?
Mhm.
And I think they actually appreciate that. So what happens normally is that almost every morning we have a surgery. I'm usually getting ready because I just got done with the gym. We have our meetings, and then you guys go down. You start the IVs, which makes it so nice. Then I come down after the IVs have already been done. You do PRF. Can you explain to kind of people that are watching what PRF is?
Yeah, so we pull blood and spin it, and then it separates the fibrins.
It's called plasma-rich fibrin. So and then we separate it. And what do you end up getting? What does it look like?
It's like a big yellow booger.
A goopy booger.
And then what do you do with the boogers?
Chop them up.
Well, you press it first.
Mhm.
You get the most of the liquid out, and what we end up with is it's kind of cool because it's like a replacement skin,
Mhm.
and we can suture it. We can add it to your bone graft. Yeah, I mean, I can't imagine doing surgery without it.
Like the perfect natural Band-Aid.
Yeah, that's exactly right. Okay, so tell me, if you were going to say, what is the one thing that you dread the most about work?
Maybe root canals.
Fillings.
Doing
yes.
fillings?
Yeah.
Mhm.
Restorative stuff.
Yeah, we don't do a lot of those.
No.
No. If we could, we'd just do surgery all day, right?
All day, every
Absolutely.
day. Yeah.
So we got a big case tomorrow. Tell everybody about tomorrow's case.
Oh,
What is
I'm
it?
so excited. So we are doing a giant case for this patient who was a cop and moved his family from out of town to be in a safer area. And I don't think it was very long after he moved here, he ended up getting stabbed.
1 month.
1 month after he moved here, he got stabbed.
6 times.
Yeah,
And
it's
shot
so
twice.
sad deal. And shot.
Mm-hmm.
And we are doing a full mouth makeover for him.
Yeah, he only has 4 teeth on top, and I think he has 6 teeth on the bottom. And we just counted it. How many implants are we doing tomorrow?
9, 11.
11 implants. 11 implants, giving him a whole brand new mouth.
Mhm.
And he's the nicest man.
And his family is so sweet.
So sweet.
So we pulled together with some of our suppliers. They've donated all of the materials. We're all donating our time, and this gentleman's just extremely excited. I'm excited to do the case for him.
Mhm.
So we're hoping that he can come on the podcast later on, and we're going to hear his story. But tomorrow we're doing that surgery, and it's going to be a pretty awesome day, right?
Yeah.
Our favorite day is one patient.
Yeah.
Yes.
Working on that one patient all day.
Yep.
Right?
Mhm.
Mhm.
Okay, so what is if you were going to say there is one thing that you dread team-wise, like having to deal with, sometimes a dental team is like a family. What is the one thing that you dread having to deal with the team itself?
Saying goodbye to any employees that choose to move on.
Yeah, that is true, right? That's good. That's a good one.
Yeah.
Yeah, we don't ever want to say goodbye.
No, we have
if
a
they're
good family. Yeah.
Which, if you're going to say what employee you like the least, who is it?
I don't.
Awful. It's so awful.
I'm not going to
I'd say the spider, that we would occasionally find.
Oh, so tell us about the spider scenario just yesterday. Okay.
What?
Well, I thought she was like one of your best friends. And what did she do?
That's why.
We are.
Okay, so what happened?
Kenzie has a big fear of spiders, and I saw one on the wall, and I tried to pick it up, and I couldn't get it. So I had McRae come in and pick up the spider, and graciously walked over and put Kenzie in the corner.
Well, I didn't try to throw it on you. What was I doing with it?
You walk in and you're just holding it like this.
Like a yo-yo.
And then you start doing this.
And
then you get a little closer.
So what do you mean I was doing this? What did
The string.
Oh,
a little yo-yo.
Like a yo-yo.
So the spider lets out a web, and you can kind of make it starts to crawl up, and then you kind of go like this, and the spider falls, and you were like freaking out. Yeah, it was a tiny little spider.
It's awful.
Yeah, well, that was
horrible.
That
We all got a good laugh out of that.
yeah, we laugh a little bit?
Oh, just occasionally.
Yeah, I would just occasionally is good.
Maybe too much.
I don't know about that.
We laugh a lot. It's good.
Yeah. What is she? What's her laugh like?
Oh, a pig. I love it.
Yeah. So it's a fun office to be at, and we constantly are laughing, which makes it a lot of fun. So I ask questions almost daily.
Mhm.
What's your favorite question that I've asked lately?
Your scenario questions.
Okay, so what give them a scenario question that we've asked.
Brings me back to your dating questions.
Okay.
I like the ice cream question.
What?
Your ice cream. Do
Oh,
you
yeah,
prefer
your-
ice cream or a cupcake?
Mhm.
So I do these dating questions for the single ones that are in the office. I've done it for years, and so we'll give them an example of some of the questions. The first question on a dating question that okay, if you are a female and you're dating someone and you want to know what kind of man they're going to be, one question is, have you ever watched the movie Braveheart? And if they say yes, and then you ask, did you like it? If the man says no, then as a woman, you just walk away. Just walk away, because that is going to tell you everything you need to know. If a man isn't willing to at least like the movie Braveheart because of the story of the movie and his love for his love, then yeah, just walk away. So that's one. The ice cream question is kind of a silly question. What's the ice cream question?
Are you an ice cream man or a cupcake man?
Yeah.
What would you prefer?
Yeah, which would you prefer, ice cream or cupcake? Even if you would prefer a cupcake, you should say ice cream, because no girl wants a cupcake guy. Correct? Correct?
Yes.
Okay. So what's one of the scenario questions? Do you remember, Kenzie?
You ask us one about you're driving in your car.
Okay, I'll give that one.
Uh-huh.
Okay, so here's this one's a difficult one, and you have to think about it. So you're driving you haven't met yet. Remember, you are a female dating someone, and you say this to the person that you are dating, and it's a one that they should think through. Okay, so here's the scenario. So the male, the boyfriend, is driving in a car. It's a 2-passenger car. There's nobody else that can get in the car other than 2 people. And it is freezing rain outside. You come by a bus stop and there is 3 people at the bus stop. There is an elderly woman that looks like she's going to succumb to the freezing rain, like she needs help. There is your best friend that saved your life, the male's life, at one point, and he owes it to this guy to help him. And it's you, or the female, the love of his life. I mean, it is the girl of his dreams is sitting there at the bus stop. What does he do? What should he do? And so there is 3 answers. There is the wrong answer, there's an okay answer, and there's a right answer. What's the wrong answer?
He gets his love of his life.
Yeah, that would be the wrong answer. Or even the wrong answer would be, okay, I'm going to take my buddy. That would probably be the worst answer. Because, I mean, that's like kind
Leaving
of
2 women.
Yeah. Leaving 2 women out there all by themselves, that would be the worst answer. The okay answer would be, I couldn't leave the elderly woman to succumb to the elements. I would have to get her to safety and then come back. Hopefully they would still be there. That would be like an okay answer. The right answer, the best answer is, I would take the keys, I would throw it to my buddy, I would say, give this woman a ride to wherever she wants to go. I'm going to sit with this beautiful girl and I'm going to take care of her the whole time and make sure that she's okay. That's the right answer. Okay, here's another scenario question. This is a good scenario question. Okay, you 2 are running, you are dating now, and you are running to your car in a Walmart parking lot because the zombie apocalypse is just happening right now. The girl says to the guy, I want to drive. What is the guy supposed to say? I knew it. Again, this is my scenario question. You can disagree with them, and that's fine. But this is my scenario questions. Okay, so what is the guy supposed to say if the girl says, I want to drive? What should he say?
No.
Because?
Women suck.
No. Because sometimes a man just needs to be a man and take control of the situation. And most likely he's going to have to take out zombies and maybe even people to get you to safety. So he's got to think that, like, okay, most of the time, yeah, no problem, you can drive. But in a really serious situation, now she might be a better driver than you. And then I could say, okay, yeah, then let her drive. Are you guys better drivers than your husbands?
I have never gotten a ticket, so.
How's your husband?
Yes.
Does that mean, okay, so in a scenario, it's flooding, you're in the mountains, who's driving?
Probably him.
Who's driving?
Me, all day long.
And you really mean that?
Yes.
Because you're a better driver?
I'm a way better driver.
Oh, what is he going to say?
Oh, he agrees. I have to back in the horse trailer for him.
Oh.
I know.
Okay. So in that scenario, and you said, I want to drive?
Yeah. He could ride passenger and shoot. He's a better shot.
Okay. So then that would be an okay scenario.
Be all right.
So that's kind of interesting. You guys have become very good friends, right?
Yes.
But you're very different in a lot of different ways.
Yeah.
Kenzie, you love country music. Morgan Wallen is your favorite person.
Mixing us up.
He might us mixed up a little bit.
You love country music.
Absolutely.
You love some Japanese, some sort of kind of music. You put up with the country music in the office.
Yeah. Occasionally it'll be okay.
Yeah.
You do. She
Yeah.
does it for me.
So,
Yeah.
so what has made it to where you've become good friends? I mean, you're very different.
We are, but working together, we work really good together.
Why? You've worked with other people that you didn't get along with. Why does it work with you two? Why? What's the difference?
Maybe that we are so different.
Maybe.
Kenzie's a soft-hearted person and such a good, kind person. I just love working with her.
Honestly,
She's just easygoing.
you know,
I think we both
You can
really
tease.
are. Yeah.
I love teasing.
Me too.
Mhm.
and I'll tell you what I see is that you're always looking to help each other. Like
Yes.
you're always looking to see what needs to be done so that you can help the other person. And you're not just sitting back waiting for the other person or I need a rest here. And you're always helping, right?
Yeah.
And so you've seen other people in the industry. In fact, we don't have anybody lazy in our practice.
Mm-mm.
That wouldn't work
No.
because you would pick up on
We
it.
are running constantly
All
at
day
work.
long. Sometimes we have a running joke that if we're so busy and I don't see Kenzie, I walk past her in the hallway and I say, "Oh, Kenzie, you still work here? I haven't seen you all day."
So that's the one thing you hate the most is coming and getting me.
Yes,
Yeah. Why?
because you make fun of how I walk and you take forever sometimes
So why do I make fun of how you walk?
because I have a loud walk, I guess.
Okay, but is it true?
I will own it.
Okay.
Just this one time, I will own it. I have a loud walk, but I'm working on it. I have a complex now.
So what do you mean you have a loud walk? So what happens?
I walk up the stairs and you can hear me coming up the stairs to get you. And so I tippy-toe up the stairs. Unless you're late, then I stomp up the stairs.
So we were talking before we came here, we were talking about laughing. And have you ever been in a situation where you've laughed and it was really inappropriate to laugh at that moment? Did I ask you, have you ever been in a situation where you were laughing and you couldn't stop yourself and it was inappropriate? Because I've got a story about that. Have you?
I want to say yes, but I can't pinpoint the situation.
Like you've ever like been in church or something like that where it's like, and you shouldn't be laughing, but you've been laughing? In front of patients, we do it all the time, but
They're
Yes.
usually sleeping.
Yes.
yeah, they are usually sleeping. But you can't think of a time? Okay, I'll tell you what happened to me, and then maybe this will spur something in you. So I was before dental school, I was in organic chemistry class. There's probably 300 people in the class. It's a stadium seating. Do you know what that means? It's like, so the professor's at the ground level and then it just goes up like a stadium.
Oh.
Okay. So it's stadium seating all the way up. I was sitting eye level with the professor. Now, here's the problem. We were in class for 5 hours every day. It was what they call an accelerated program. So you got all of your credits in 3 weeks, but that's the only class you took. So we had 5 hours of lecture and 3 hours of lab every day, 8 hours straight of organic chemistry. It was miserable. It was an awful way of getting it, but you get through it, and we were getting through it. So I had to take 2 semesters. This is the second semester. Already went through the first semester. I was so happy to get a C. And you're just happy to be able to pass. So I'm sitting there and I look over and it's right after lunch. And Todd, I think, yeah, it was Todd Christensen. He was a friend of mine that we drove every day from Logan to Weber State. Anyways, he's sitting there and he is completely asleep. I mean, his head's back. He's not snoring, but his mouth is completely open. And I'm sitting there with my marker. I've got a highlighter in my hand and I'm like, okay, I've got it. I'm going to do something. And I was looking at him. And so I just take my marker and I shove it as far as I can up his nose. I mean, right up his nose. And he comes flying out of his chair. And he is like, he's going to fight somebody because he thinks he's.
Oh, no.
And anyways, I start laughing and he starts laughing. The professor, he does not miss one word. He keeps word laughing uncontrollably. He doesn't say a word to us, but we have to get up and we have to excuse ourselves. We're laughing the whole way out. Everybody in the audience is laughing. The professor doesn't ever stop.
Oh, how awkward.
That is so
It's just basically the message I got from the professor was, I have to teach this. It doesn't matter what you students do. I'm just going to teach. And if you don't want to hear it, that's fine. And he just kept going. Didn't say a word. Didn't like, okay, you guys, you leave or anything like that. It was the craziest thing. I shouldn't say this. I'm going to get in trouble. Okay. That lab, the lab for organic chemistry was the worst. We had 3 hours at the end of 5-hour lecture. There was 4 of us that drove from Logan every day. And so what we did is to get through it as fast as we could, we'd have 2 of us that would work at the beginning of the lab and 2 of us that would work from the back of the lab. And then we would meet in the middle and we would share our information so that we could get out there as fast as we could. Oh. And so we normally would get done in about a third of the time at about an hour. And it was just a weeder course that you had to get through. Oh, I hated that. Man, I think back to some of the things that we had to do. It was awful.
You were efficient.
We were efficient. We were efficient.
Still are.
Okay.
Still are.
One time I remember we had to get a certain temperature of this liquid and it had to be orange color. And so the instructor comes by and he's like, well, you got the temperature, but you didn't get you didn't get the color correct. We're like, well, what color are you looking for? He's like, no, there's got to be an orange tint. Well, somebody had an actual orange in their lunch. And we took a knife and we just got some of the zest off the orange and we put it in the liquid. And we had him come by. He's like, wow, you guys got that fast. Yeah. He marked it off and we were done.
Oh my God.
Out of there.
Oh.
And we were done. We weren't supposed to use an orange. So, yeah.
You're good at making things work.
Yeah.
Still.
Yeah, I kind of have to do that, huh? Sometimes.
Time. Yeah.
Yeah. So if you were going to say there was something in the office that you wish that you could do more of, what would that be?
Surgeries, big cases,
Yeah, just planning for those.
transformative cases,
Hmm.
Yeah, 'cause
and
that's
cosmetics. Cosmetics are good.
but
Fun.
what would you rather do? Would you rather do like a veneer case, or would you rather do like a big surgery implant case if you could pick between the two?
Implants.
We're kind of getting best case scenario with our case tomorrow. We're doing
A little bit of
a
both.
little bit of veneer, a little bit of implant, but a full smile makeover is just 100% the best.
I think the outcome of the patient and watching the patient
Mhm.
transform is the best part.
So I think that's important, is that what we've kind of made a name for ourselves in is the ability to be able to take someone, change their smile in a very high end way, and also do the surgery that the patient needs all at the same time, and sedate them, and do the best practices when it comes to the surgery to be able to do that. Correct?
Mhm.
Yeah. Um,
And I think it's more than just we're cutting someone open today. It's the relationship that we build with them before the day of surgery, I think, is the most important part and the best part. Because we're getting to, they come back and forth to our office and we're learning who they are. And once we finish their case, sometimes they're saying, I've quit smoking, I've gained confidence, and I can talk to people again. Like that's what it's all about.
yes, we just had a gentleman come in. Was it 2 days ago? And he was in his 40s. He was a drug addict at one point, and then he basically he lost all of his teeth, and he had zero confidence when he first came in. And we took all of his teeth out. We placed, I think it was 12 or 14 implants on top and bottom. And then we finished his case a while back, but he came in for final pictures just yesterday, right?
Mhm.
And it's so cool to hear their stories and where they're at today. And I think he said all he wanted to do was to chew. He wanted to chew a hamburger.
Mhm.
He just wanted to be able to chew a hamburger. He's like, man, I could chew anything now. And he was just so happy. But what he didn't realize was the confidence that new teeth would give him. And what did he say? Something to the effect of, I asked him, what would you tell someone that had to go through that? And he was saying something to the effect of, man, I would just tell him, get this done because it's going to
Mhm.
boost your confidence like you have no idea. And I can't, do you remember anything else he was
They all
saying?
say that basically. Just be patient, but do it.
I think the cool part too is a lot of the patients that do things like that see it outside of, they see it in their lifestyle. So the patient yesterday said that he has his own business and his own business is booming now. And
Mhm.
I can even think of a couple patients right now that they're accelerating their sports and just things outside of the realm of teeth because their confidence
Mhm.
skyrockets afterwards.
So what are the two that I can think in my head? What are the two things that patients are the most afraid about having to go through a large process like that?
I think their diet is a big one.
And
Mm.
pain
Mhm.
management is a big one.
Mhm.
And finances.
Finances, for sure.
Yeah, how much it's going to cost, because it is expensive. I mean,
Mhm.
sometimes we tell patients, okay, this is going to be $40,000, and you're like, man, that's a lot of money. Um, but once they go through it, have we had any patients go, man, I wish I'd have never done this?
Mhm.
No.
No, they're usually just really happy after the process. Now, is there sometimes pain? Be honest.
Oh, yeah.
Sometimes, yeah.
Mhm.
Yeah. Yeah. And sometimes we have to deal with that. But I'm amazed at how often we do implants. We'll take a tooth out, do an implant, patient comes back, and a lot of times, what do they say?
They usually don't have
Yeah, they have
pain.
no pain.
Yeah.
Maybe, that first day, but
Why do you think
yeah.
that is?
I think it's the way we do it.
Mhm.
So what is the way? Sometimes it's hard for me to describe it in your words. You've seen other people do implants. You've seen how it's done out in the industry. What sets us apart in comparison to the way it's done everywhere
You've
else?
created the all-in system where we can extract a tooth and place an implant in the same exact way that the tooth had looked. So they get a tooth the same day, but the socket is completely sealed. And that's very different from the old way of doing implants.
And it kind of goes back to what you were saying, Kenzie, with we get to build that relationship before through the whole process of surgery. But at our office, they get to come in. We have them come in and do preliminary work, and we're getting to know them before, and we do their surgery in the computer before they come in. But we get to build that relationship before they even come in for surgery, so they feel a little bit more confident when they come in and we get ready to do their IV, and we can kind of calm them down a little bit, and it's a familiar face and the relationship aspect of it. But also, I mean, they do get to walk out with, you can't replace God's given teeth, but we can replicate it the best we can, which is awesome. Same day.
Yeah.
Which is unheard of.
They're confident in knowing that you can do this surgery completely in a computer first, so there's no guessing involved.
And then what do you do? So you've even been in some of those planning meetings. You've seen how the planning meeting goes with the team that we have that does it in the computer. Then after that, we have a detailed plan. What do you do with that plan?
We hang it up.
Yeah. So
We mark it in every place possible so that we can see everything right there in front.
Yeah. Down to the specific millimeter of sizes for parts and medications.
So in our surgery room, on one wall is the entire plan that has been planned. All of the components are sitting out to be able to make sure that we follow that plan. You guys are the ones that make sure that I am following that plan. Right?
Yes.
I mean, just yesterday, what did you tell me? You're like, that's a 14. That's a 14.
Yeah.
Because normally it's a 12. And I was just testing you to see if you were going to tell me. And sure enough, you told me. I was like, thank you, doctor. Thank you, doctor. and yeah, that actually turned out really well. So I trust you and you trust me to make sure that everything goes well. Does it always go well?
Not always.
Not always, because we're dealing with humans. But majority of the time it does. I mean, it even surprises me, and we've done now thousands of these cases. It surprises me when it's just so accurate. When it doesn't go well, it's usually that their bone just simply is not strong enough. But we constantly change our protocols to get better and better. I'm just thinking of one of the things that we've tried recently that I think has helped dramatically. So we used to, even if the patient had a large abscess, we would take the tooth out and try to place the implant same day. Now we've changed that. And what's our new protocol?
We only wait 3 weeks.
So we take the tooth out, we wait 3 weeks, and then we put the implant in. And what ends up happening is we're ending up with much better outcomes. And we're not relying on potentially having an abscess that is around a fresh implant. So that's worked extremely well for us. If you were going to talk to a friend and they were looking at, there's a lot of different places they can go. I mean, they can go to an oral surgeon, they can go to a periodontist, they can go to a lot of different places. And sometimes that I still think that in certain scenarios, like large bone grafts and things like that, I think oral surgeons and periodontists are very necessary. But why would someone come to a general dentist like me? If you were going to talk to a friend, what would you tell them?
Look at how much you teach, the experience that you've gained for yourself, and you travel all the time just teaching other dentists how to do this. That alone would bring more confidence in knowing you know what you're doing.
And the confidence you display too is huge. And I know patients don't see it because they're sedated, but in those cases, if something doesn't go 100% according to plan, you are calm about it and you know a solution for it. And they don't see.
So I'm not throwing instruments at you?
No, you never do that.
Have I ever?
No.
No, I really
Actually,
don't.
no.
I don't think you've ever raised your voice for anything, even in the highest stress situations. You're really calm.
True.
Yeah.
There's
Mhm.
never a
You're
moment
never
of
you get frustrated, but it's like an equal amount of frustration
yes.
between all of us because we want
Mhm.
it to
Yeah,
work
but
out. But
the worst thing I do is just get quiet,
right.
Mhm.
right?
Yes.
It's
Yes.
like when I get quiet, you guys know that okay,
Mhm.
it's getting serious.
Mhm.
Mhm.
And then usually, and then I start talking. It's like, okay, the crisis is over.
Mhm.
Now everything is fine, and we've got everything working out just fine. But we're dealing with people, and they have expectations. And what I end up, I'm trying to reach an expectation for the patient when it's not the outcome that they're looking for. Let's say we're trying to place an implant, and it just we don't have the bone that we thought we were going to, and we have to do a delayed approach. That's something that bothers me because I know that the patient's going to be disappointed.
Mhm.
But we want the ultimate outcome for them, and that's what we're looking for, right?
Yeah.
So what are the what in talking about teaching, I've asked both of you to potentially go to Belize and be able to teach in Belize with us. And are you excited about that?
100%.
I'm nervous.
Yes.
Because the furthest that you've ever been is Ontario, Oregon. Is that right?
Okay, maybe. I'm nervous. It'll be
I-
okay.
Have you ever been out of the country?
Never. I didn't even have a passport.
But you have one now.
I have one now. I'm ready, set, rock, and roll.
Okay. What would be the one thing that you're the most nervous about?
Leaving the country.
Yeah, but why?
Because it's just unknown to me.
Yeah, but what is the thing that I know what you'd be the most nervous about? What is the thing that you're most nervous about going out of the country?
The food.
Yeah, the food. Yeah,
So picky.
because
I'm a picky eater.
you eat
I'm uncultured.
you eat macaroni and
Oh,
cheese
no.
and chicken sticks, hot dogs, and French toast sticks and cereal,
Okay.
and that's about it. That's all she eats.
Oh, my
wait a
goodness.
minute. You eat brisket from Costco.
I do love their brisket. It's good.
Okay, but what? Okay, just recently you have found a new food source, and I said you should try this, and you tried it, and you were like, "Oh my gosh, it is good."
Oh my gosh. Cottage cheese is a life changer. I eat it every day now. I have to get big tubs.
Okay, but you would never you would not try shrimp,
No,
salmon.
no seafood.
Okay,
I'm paranoid
why?
because shrimp are see-through.
Well,
And you put salmon in my lunch a couple weeks ago, and I refused it. I threw it away and bought a sandwich because I will not do seafood. I am making an effort, though.
Okay, so if we went to Belize, are you going to at least, because it's seafood's everywhere, are you going to at least try some
Do
seafood?
they have, like, chicken nuggets
No,
there?
no. Sometimes it's just seafood
I might try it
if you get hungry enough.
if I get hungry enough.
I want a commitment right here and right now. You'll try everything.
I knew you'd do this.
Everything in Belize.
One bite.
One bite.
Okay.
Deal?
I'll do it. Oh, jeez.
Okay. All right. Kenzie, you were pretty picky before we went on the cruise.
Oh, yeah. Casseroles were my main food source.
And now?
I've tried everything you've put in my face.
Yeah, you've done really well.
Haven't you tried a snail?
Oh,
You tried escargot
I did.
and you thought it was
It
good.
was a mushroom at first, and then you told me it was a snail,
See,
and then it
that's what
became a snail all of a sudden.
I did. I told her it was just a mushroom, and she's eating me like, these aren't too bad. And then I was like, do you know what you're eating? And she goes, yeah, a mushroom. And I was like, no, that is a snail.
It started growing tentacles.
But it wasn't as bad as you thought.
At first, yeah, it was good.
At first.
So food is always an issue when you go out of country. But so tell kind of the audience, what are we going to be doing in Belize?
We're going to go train doctors, new doctors with the patients from Belize. And I think you said you wanted to train doctors in Belize too, right?
So I'm going to potentially go down prior to the course that we're going to be teaching at American doctors. So the people in Belize has a population of about 340,000 in the entire country. Out of that 340,000, there's only like 15 or 16 dentists. Out of those 16 dentists, only 2 of them actually place implants. So what I'm going to do is go down, train some of the doctors in Belize. But then we're also going to then go to a clinic and train doctors from the US on showing them how to be able to treat the people in Belize. So Belize it's interesting. There's 340,000 people, but they have 3.2 million visitors a year. So
Wow.
the people that are coming into Belize, they're all visitors. And so it is so the people of Belize um, would be third world, fairly poor. They just can't afford it. It's some of the dental work. So I'm excited to be able to do some of that missionary work, and you'll be able to see that. I've done quite a bit of that around the world, but to have you guys there to be able to experience that and to see working on people from their own country in that scenario, and then also training doctors, it will be a really cool experience.
What was it like when you did your first mission trip?
Oh, that was something else. Our first one was in Kenya, Africa. That was back in 2006. We saw 700 kids in 5 days.
Wow.
And I was a little bit of a madman because I was trying to see as many of them that I wanted to make sure to see everybody. And for some reason, um, I'm thinking of the very last day. It was right at the very end of the trip. We had just finished all 700 and saw every child. And so I don't know, we did 1,000, 2,000 extractions, something like that, a bunch of fillings. And then this one, he was not part of the school and he was trying to get into the military. And he came through, and on his wisdom tooth, it was completely bombed out. I mean, it was gone. And so I'm like, okay, I'm gonna extract it. And he goes, I can't have it extracted. Apparently, you have to have all of your teeth to get into the military. And so he begged me to leave it in. So I took the tooth, I got all the decay out, I removed the nerve, kind of did a baby like root canal on it, and then I built up the tooth so it looked just like a natural tooth, and so that he could get into the military. And then once he's in the military, then they will extract the tooth. So I remember doing that for him, and he was just so happy. He got up, he was probably 19. He gave me this big old hug. It was really cool. And then they had this like going away party for us at the school. It was one of those things that I'll never forget. And then right afterwards, we went on a safari for 3 days. And so we flew to the Masai Mara, and man, I remember I remember going into the it's like when you go into Yellowstone, they've got the gates, and you go into Yellowstone and you're like, okay, am I going to see any animals? And then you start seeing buffalo and you start seeing stuff. But it's kind of like a little bit here and there. And I remember we were in this open Jeep, and as we're going through the gates of the Masai Mara, I immediately saw a wildebeest about 300 yards off. I had binoculars. I'm like, "There's a wildebeest," and I tell the guide and the driver, "Hey, I want to take pictures." And he's like, "No, you don't need to take any pictures. You're gonna see a lot of wildebeest." And I'm like, "You don't know that? This might be the only wildebeest that we're gonna see the entire trip." And he goes, "No, seriously, you're gonna see lots of them." And they just kept driving. And I thought, okay, well, I I'm paying for this. Why don't you just stop? I got so sick of seeing wildebeest. So the next morning, we took a balloon ride in the Masai Mara at 5 a.m. My wife was not happy. She had to get up. But after we got up into the balloon, the sun came up. That day, that day that we were there was 1 million wildebeest that went from the Serengeti to the Masai Mara. And when we went up, it literally looked like ants. We saw just
Wow.
millions of wildebeest everywhere. So the guide was right. So we're flying in this balloon. It's the coolest thing. We're flying this balloon and we're about ready to land. And we're going to land on this road. And as we start to land, we look down and there is all these cubs from a lion and moms with their cubs on the road. And he's like, "Yeah, we can't land here." And so he gives a little bit of air, and we're probably 25 feet above these lions.
Wow.
And we fly right over them. We go, I don't know, about 400 yards down the road, and then we land in this like pasture area, and it was the coolest thing. I loved everything about Africa. I would love to go back. Want to go to Africa?
Let's go.
Yeah.
Let's do it.
Mhm.
Yeah, that would be good. Any other questions that you would like to ask me?
Why did you hire me?
Oh, that's a great question.
I want to know too.
There is something. First of all, Kenzie, when I first met you, and there is sometimes I don't always get it right, but when I meet certain people, I could tell that you were a people person. I in both of you, I don't care what you know about dentistry. I really don't. It's the person that you are. If you can talk, you have a pleasant demeanor, and it looks like you'd be somebody that's gonna. It's not just what I think as well. It's, are you going to fit in with the team? We have a specific like team, and there's specific strengths that add to the team, and there's even some weaknesses, but it's are you going to add to the team? So it was one of those. I came in, I knew within 2 minutes that you were the right one.
Aw.
And I mean it. I mean, it was like, oh yeah, I'm definitely want to hire. That's why when you said, okay, I have this other working interview, I was like, well, yeah. And I remember being nervous that you were leaving, and are you going to like the other? And you went to that interview, and what did you think?
I couldn't wait to leave. Honestly.
And didn't we have I think we had a patient appreciation
Mhm.
party type of thing, and you came to that.
Yeah, I drove 4.5 hours just to come to that.
Oh.
So I knew from that it was like, okay, we definitely got the right pick. And then you came on the cruise. You were new. You mingled great with the rest of the team. You just left us all and went and had your crepes and didn't tell anybody that they had phenomenal crepes at midnight.
Come all from me.
Yeah, that's probably true. And Sarah, I just remember when you first came in, I remember how excited you were to be there. And it was one of those things where it was like,
I was 7 months pregnant when you hired me.
you were.
I didn't even finish my 90 days before I went on maternity leave.
But I think that, what does that tell you? That again, it's the person that you are. You have, here's what the one thing I can't teach. I can't teach how to give you a personality, how to deal with patients. How many times do we hear, man, I just love the team, I love the people that work here. It's because we hire people that have an ability to be able to work with people. They love people. And you two are great at that. You really are.
Thank you.
I mean, I could not, I've had some phenomenal assistants. You are two of the best that I've ever had.
Oh, thanks.
And so just don't go anywhere.
We've already agreed that we retire when you retire.
We are. We already have backup job plans that are not dentistry.
Feet pictures, is that what it is?
Maybe.
So one of the things that, why is it that when we are working on a patient and they've got a huge abscess, why is it that we enjoy seeing the pus come out of these huge extractions? We extract it, and then all of a sudden we start seeing this pus, and it's like, I don't know. I get giddy wanting to remove that. And it's right. Why is that?
It's exciting.
It is. It's kind of cool.
Are we pimple poppers?
Absolutely.
Is that what we are?
I think so.
But would we want to do that on somebody's back?
No.
I mean, I might.
I don't think I could.
What if it was like a huge, I don't even know what you call it on the skin, like a big old fat one?
Let me at it.
You really would?
Oh, yes. Ingrown hairs are my thing.
Yeah, me either.
I can handle blood in the mouth. Anywhere else, no.
So we get patients ask us all the time, I don't know how you guys work in the mouth. Do you know what I say to them? I'll take that orifice over any of the other orifices that are in the body.
Me too. Me too.
I don't want to work in bum holes and then urethras and then womanly things. Nope, no. I'll pick this orifice. This is the orifice that I like to work in. But it's a tough environment. It's 100% humidity. It is a black box that we are working in. It is a very small. One of the hardest things we deal with is patients that can't open, or they get irritated because and rightfully so, their jaws can become irritated. What's nice is when they're sedated, we don't have to worry about that near as much because they can relax, right? But I was thinking about that the other day. We really do. We get into it. So in fact, I kind of get mad at you because we record all of our surgeries. And I get mad if you do what?
If we don't show the audience our nasty pus pocket that you pull out and wave it.
Like, wait, put it back.
Exactly.
Hold on.
Yeah, because I want to show that big old pus pocket that I just pulled out and painstakingly got out in one piece, and be able to show. And it literally looks like a big old booger with a sack around it.
Yeah.
That's the best way to put it. And then once we get that out, what I think is, I'm going to really help this person. And then once I get that out, I know that this person's going to feel a lot better. I mean, we have seen in our practice people get really sick from these. The 5th leading cause of death before antibiotics was tooth abscesses. Every year it kills people all over the world, and it still kills people in the United States. There was a little boy, I think he was 9 years old, and the parents refused to take him to the dentist, and in 2 days after the abscess was formed, he was dead.
Wow.
He became septic. He got really sick. Took him to the emergency room. It was already in his blood. It was too late, and he died.
It's awful.
And so I look at this and I'm thinking, okay, this is what we do to be able to help people out. Which brings up another topic, which I think is really interesting. People always ask, what is the latest and greatest when it comes to technology of replacing teeth? This is what we do. We replace teeth. We replace teeth in the very best way, that it's the most natural of what God gave you originally. I don't think there is a better way of replacing a tooth than the way we do it with our implants. It is way beyond. When I go out and I teach other dentists all over the world, they can't even comprehend the concept, because we literally are taking what God gave you in what we call the root form, and we are giving you that root form exactly back what you had originally, which then ends up with the least amount of resorption, and so you end up with the best outcome. And we've seen it where it's indistinguishable from their other teeth, which is kind of cool. Which, don't you love seeing that?
We have patients saying, "Did you even do anything?"
Yeah, and that's what we want. I mean, when you can do it in their front tooth, and you can't see the difference between one tooth or the other, that brings a lot of joy to me. But you look at what is new and what technology is going to bring. They just reported just yesterday. Did I tell you guys about this? Just yesterday, there was a news story that came out that there is a research team in Japan that they have come up with a drug that they can give intravenously that will grow any tooth that you've lost.
Really?
Think about that. So it blocks a specific gene. They are hypothesizing that we actually have 3 sets of teeth that is possible. So that if you lose a tooth, you give this drug, it will grow a new tooth, your actual tooth. And then I know that, people like me that do these surgeries, well, then we won't need implants. That's not true. Because here's a couple things. I guarantee you It's going to be, okay, you lost this tooth, and they're going to do a study, and all of a sudden a molar is going to grow right out of this front tooth. It's going to be like, okay, yeah, it's going to, because you got this wisdom tooth back here. All of a sudden you got this molar that's going to grow. They're going to have their own issues. The other thing is that you only get 3 sets. So yes, you might lose a tooth. You're going to have that one, but
Where's the third set hanging out?
I don't know. That's the thing that they're hypothesizing, that they say that they're going to start doing human trials immediately, and that it would be available, just starting to be available in 2030.
What's your take on it?
My take is I think we sometimes go, okay, well, that's going to completely remove our ability to do implants. No, I just think in the long run, we are going to be busier than ever. And I was telling you guys, I listened to a Joe Rogan podcast. They were talking about AI, and they're estimating anywhere between 10 and 20 years from now, almost all jobs will be completely obsolete because of AI.
That's crazy.
Now, do I think that that's going to be in our industry? No. There is nothing that was going to take over what you two do so well, which is the human touch. And that's what patients are always going to be about. And that's what we do.
Mhm.
So I want to thank you two. You are a blast to work with. You keep me in check. Sometimes I don't like it always, but I really enjoy working with you two. And thank you so much for being a part of our team.
Well, thank you for letting us.
And that's a wrap.